Hello, my name is Maricely Baez. I wanted to talk about a specific disease that is Parkinson disease. So this disease is a degenerative disorder of the central nervous system to affecting the motor system. The motor symptoms of Parkinson disease is a result from death of dopamine generated cells in the blood system in a region of the main brain. Dopamine is also decreased in areas of the brain responsible for cognitions. This lack of these dopamines occur especially in the part of the brain known as the basal ganglia. The basal ganglia are responsible for organized movement, command from other parts of the brain. The loss of dopamines causes Parkinson's disease symptoms. The cause of the cell's death are poorly understood because the most obvious symptoms are movement related. These include shaking, rigidity, slowness of movement, and difficulty with walking. Other symptoms include sleepiness and emotional problems. Some patients develop memory loss and dementia. Generally in this disease progressions. So Parkinson's disease is more common in older people, most cases occurring after the age of 50 years. The main model symptoms are collectively called Parkinsonism. This is a progressive neurodegenerative illness. So the treatment are effective improving the early motor symptoms of the disease. This is typically with the medications of L-DOPA, dopamine. So diet and some form of rehabilitation has shown some effective and improving symptoms. Surgery and brain stimulation has been used to reduce these symptoms as a last resort in severe cases where drugs are ineffective. There is a speculation of several mechanisms by which the brain cells could be lost. One mechanism consists of abnormal accumulations of protein in damaged cells. So this insoluble protein accumulate inside neurons, forming in inclusions called Lewy bodies. The diagnosis of Parkinson's disease from the medical histories and neurological examinations. So to identify the disease clearly, brain scans are sometimes used to rule out disorder that could give you rise to similar symptoms. The finding of Lewy bodies in the main brain autopsy is usually considered proof that the person who has Parkinson's disease. So the problems of the illness may be revealed is not a Parkinson's disease, and so doctors recommend that the diagnosis can be periodically reviewed. So I have a history very close to this disease because I have someone in my family who present the disease. So each passing day I realized that the disease progressed with my grandfather. He was a very active person, and I remember when I was a child what happened with his hands. He was taking a medicines and he can control a little bit his hands. The disease was invading his brain, and his cells of the brain were weaker. So the Parkinson's disease for my grandfather was very hard because he lost the life and his brain doesn't work anymore. For me, this is a very sad history, and I saw every day when he had the disease, he never was the same again. So this is a picture who he appeared with me, and I always remember my grandfather. Thank you for viewing this video. Bye.